Bismillahirrahmanirrahim. The purpose of this video is to give proper information to the students about the resources given from the pathology department and the assessment methods. So in the principles of disease module related to the pathology, we had two sessions. One is lecture sessions and the laboratory sessions. In the lecture sessions, we given the handbook. This handbook is prepared from the Robbins textbook, and the explanation of the handbook is recorded. It is called screencast, and which contains basics and the lecture explanation, so which is uploaded and it is there in the Dropbox, and the student can approach their group leaders and they can take the recordings. I hope it is available with all the students. It is with all the students. So from this lecture session, we assess them by a format called multiple choice questions. In the N block exam, we asked 15 MCQs in that 6 small cases. And in the end semester exam, we asked 23 MCQs where there is no cases in the end semester exam. Now I want to discuss certain things which we received from the students as a feedback. So these are the 5 and around 3 to 4 problems they mentioned and related to the laboratory sessions. So they told the session which they had was very fast. The session looks very fast because we have to cover certain outcomes within 1 hour. So most of the students, they don't have the basics for that lecture session, so I have to take the basics, so I have to make them understand the basics, then only I can able to take the lecture. So it may look fast for the student who have weak linguistic skills. So for that reason only we gave a solution, the screencast, the recorded sessions. So we recorded the sessions and we gave to the student, so who feel it is very fast, they can see the video recording again and again so that they can understand. So I asked with some of the students, the screencast is really useful. They gave a positive feedback and they want us to continue with this type of strategy. So this is the solution we can provide for the problem. Actually the problem, the students saying the lecture is very fast. So now coming to the next problem, what the student mentioned is the English. So what we are using is the academic English. It's not any literature English, which means it's not a literature class. So we are taking the whether the student able to understand the concepts, that is very important. So it is not the style of the language or slang of the language is going to be important. So what we are using is the academic English, and the same English and same method, same strategy we used, and we are experienced with other university students, and alhamdulillah most of the students uh, never had a complaint of this sort of things. And so this is basically due to the different issue here, because most of the students who complained about this language issue, they are written in Arabic. Okay, I'm not blaming them, and this is the problem we face with some of the students, that they have weak linguistic skills, especially in understanding the English. So for that only we again gave the solution as a screencast, so they can use the videos. And another problem the student mentioned is that we don't spend time for the questions. Actually, I personally feel if some student is telling like this, it is a lie, because we given the poster which mentioned 10 hours per week for the students. Okay, for female students 8 to 9 every day, and we spend with the students, and 3 4 to 5 we spend with the male students. So 8 to 9 we spend with the female students. So most of the many students come to our department and they get the benefit. Not only I'm talking about your batch, there are many students who finished the 4th year. They also come and discuss with us. So I can proudly say that Department of Pathology is very much student friendly, and we are totally engaged with the student whenever we have a time, apart from this 10 hours. So if somebody is telling we are not giving time, then I feel like it is a exactly I can say it is a lie, because if you ask any student, they will tell us how much time we give to the student and how many of them get benefit from us. So if somebody is telling this, I, I, I think that they may not aware of our timings and how we give appointment to the students. So this I use this video as an opportunity to tell those students, you can mail us, you can message us, and you can call us in case of urgency, and we give you time. In case you can't come, you put your question in the email and we explain you. In case the certain questions cannot be explained in a textual format, then we will give you a time, and you have to maintain the time and you have to come and meet us during that time. So and many students get benefit by this procedure, and you also can get the benefit. So we are always uh, open the doors for the student, and you can come to our department, and if you have any doubts or if you have any problem in learning, so any issues related to the academic, we will try to give some solution for it. So now coming to the infrastructure, some of the students complained about the in the lab they have difficulty in seeing the screen. They get some neck pain because of they sit close to the projector. uh, so for that, inshallah, we are going to provide networking to all the systems, so that the students can see from the uh, monitor, the computer monitor which is in front of them. So it will be more useful, inshallah. In the next lab session we will try to bring the networking. So this department always look for the solution. So I asked us to, from our side we are providing certain solutions. Use the screencast effectively, and inshallah we are also planning for more professional screencasting, more professional way of putting the videos, and which includes the lab sessions in future. And we will also try to go slow in the sessions if time permits. And from your side, I also expect, as a department in charge, I expect certain things from your side. And the students which have serious linguistic issues, try to improve their language. And I'm also going to provide a different solution for those students. And and we tried with the dental students, it was very effective. Inshallah, in the end of the class, the 10 minutes, we will try to summarize the whole content in Arabic with the help of the best student in the class. So this we did it with the dental students. It was very effective, and we found it very useful for the students who have difficulty in learning directly in the lecture. So, and one more thing we are planning to start, which we started already for dental student. It is called faculty moderated student discussion forum, which means a faculty will be there, and the best student will be involved, and the student who has a difficulty in language, they will be there in the discussion. So it will be arranged in the lab, so that I will be monitoring the student, and the students will discuss and explain the weak student. Weak student means not in the perspective of they are weak in the knowledge, they are weak in the language. So once this barrier is lost, so inshallah they will also become a good student. So this we tried with the dental student, it was really successful, alhamdulillah, and same thing inshallah we will try it for the MBBS student, especially for your batch, inshallah. So these are the solutions we are providing from our side, but we need your cooperation and expect you people to respect the teachers and cooperate with us. So, and one more suggestion I can give to the student: many students can come and sit in the front row who has difficulty in understanding the lecture. So if they, I personally feel if they come sit near to the lecturer, so they can hear the lecturer better, and they can if they have any serious issues, they can ask question, so that lecturer can explain to them in the class, or he will tell the student to come and meet them in the laboratory office, so that they can explain to them in private. So these are the solutions at present we have. Inshallah, we found it very helpful in dealing the mentor student. I hope inshallah, I hope your batch will also get the benefit from it. Inshallah, we will try to do it. So now coming to the laboratory session. Okay, so before going to lab session, these 6 cases will be asked from the examples which we discussed in the class. Only from those examples these 6 cases will be asked. So if you are very 100% thorough with that example, then definitely these cases will be very easy, because I discussed these cases many times, because I use example for explaining the principles. This is very important. So, and these cases are also very important because we are assessing your application knowledge. So if you are able to understand the examples which we explain and the principles behind those examples, then you will definitely answer all those cases. So now coming to the laboratory session. So in the laboratory session, the resources which we provided is the practical book and the record notebook. So record for the work you did for the record notebook, we gave 2.5 marks. We gave 2.5 marks. Inshallah, the record notebook will be ready after correction, and you can take it on Monday, that is 16th to February 2015. And for the females, they can come and collect the record book from 8 to 12, and for the male students, they can come and collect the record book from 1 p.m. to 5 p.m. So how we are going to assess the student in related to the lab session? By a method called objective structure practical examination. It is otherwise called as OSPE. So in the end block exam, we are going to keep 5 slides. In that 5 slides has 5 marks, and end semester exams again 5 slides and it has 5 marks. Okay, what are those slides? The first slide will be of technical reasoning. So the technical reasoning, we are going to give 1.5 marks, very important, because it is very important when you are dealing with the tissue. So you should be thorough with the formalin and the fixation process. You should be thorough with the formalin and about the fixation. So which is a commonly used fixative is a formalin, but you should know which percentage, how much percentage we use, and all the details of the formalin. And then you should know about stains. So what is the common stain used is hematoxylin and eosin. So you should know about hematoxylin, what is hematoxylin, what are the areas in the cell is stained by hematoxylin. And meanwhile in eosin, you should know what is eosin and what are the areas stained in the tissue in the cell by eosin. So these are the two things you should know regarding the hematoxylin and eosin stain. Okay, so if you know this, definitely you can able to answer this slide, and you have to write. There is no oral examination in related to the practical, it is only written examination. So the slide will be there, there are bottles will be there in the slide, bottle images will be there, the solution name will be given in each bottle, and the question will be asked. You have to write according to the question. Okay, so in the technical reasoning we will be targeting about fixation and stains. Okay. Now coming to the clinical reasoning. So the clinical reasonings, again it is very important, so we are giving 1.5 marks for the clinical reasoning. 3 questions will be asked. So the clinical image will be there. So we discussed the clinical images in the laboratory sessions, and it also discussed in the lecture sessions as well, and it's all available in the video. And the clinical reasoning is very important, because you are going to see the cases, you are going to see the patient, and when you see the patient, when you see such condition, your brain should run what is happening in this patient. So what are the principles behind that change? So you should be able to name the clinical condition, and you should be able to reason why it is happening. At least you should mention one cause for that condition. So now coming to the machines. Machines means instruments. For that we are giving 0.5 marks. So these are the machines will be covered: tissue processor, microtome, L block, Leukertz block, and embedding station, digital scanner, and the microscope. So with these instruments we will keep one machine, and you have to name the machine, and you have to mention at least one use of that machine. Okay, for example, if they keep tissue processor, you should write it as an automatic tissue processor. What is the function? It processes the tissue, and what are the processes it does? Okay, it dehydrates, it clears the tissue, and it infiltrates the wax in the tissue. So like that you should be able to write the use of that machine. Now coming to the next slide, that is gross specimen. So it has 5 marks, 0.5 marks for that, and there are 12 specimens discussed in the laboratory sessions, and we should be able to name the organ. For example, if it is a myocardial infarction which they kept, and you have to name it as a heart, and the lesion is transmural infarction. Likewise, you have to write for the gross specimens, it has 5.5 marks for that. And now coming to the last slide, it is a histopathology slide. It has 1 mark. So total 8 slides has been discussed during the practical laboratory sessions, and you have to describe the slide and you have to write the diagnosis. If you are writing only the diagnosis, we will give 0 mark. So if you write only the description, we will give half mark. So because without description you cannot come to the diagnosis, you should know completely about the description, then you have to write the diagnosis. In that 8 slide, we will ask 1 slide. So this is all about the histopathology slides. Okay, so OSP exam related to the pathology. So we keep 5 slides for the end block and 5 slides for the end semester. For end block it is 5 marks, and end semester it is 5 marks. So including the internal 2.5 marks for the record book. So totally 12.5 marks for the laboratory session from pathology. So this is all about the how we do the assessment. Now I am going to discuss few minutes about how to prepare yourself for this assessment process. See, this is my suggestion. It's up to you to follow or not. So first, okay, you start with screencast. See the video, then see the handbook, study the handbook. Okay, then if you are covering the lecture 1 and 2, that is cellular adaptation and cellular injury, for example, then you go to the, after finishing this lecture, after finishing the screencast, after finishing the handbook, then go to the lab session 1. Study the lab session 1, what are the things they discussed in the lab session 1. Okay, so you will be studying about fixation and stains, and about machines, and the gross specimens discussed, then the histopathology slides, because the background knowledge for this is this lecture. So see the screencast, then read the handbook, finish the handbook of the, for example, you are seeing the screencast of lecture 1 and 2, then read the handbook of lecture 1 and 2, then go to the laboratory session and finish the discussed part of the laboratory session. Likewise, next you go for the lecture 3, 4 and 5, that is related to the acute inflammation, chronic inflammation and tissue repair. See the screencast, then see the handbook, read the handbook, then go to the laboratory session part 2. So then go to the specimens, clinical images and histopathology slides discussed related to that acute and chronic inflammation and tissue repair. After that, see the screencast of the lecture 6 and 7. 6 and 7. So it is hemodynamic disorders. So then see the screencast, then go to the handbook, read the handbook, then go to the laboratory session 3. So likewise you continue for the 8 and 9. See the screencast, then go to the lecture, a handbook, read the 8 and 9, then go to the histopathology laboratory session 4. So if you go in this order, you will understand and you will easily memorize the things. So you can able to answer the recall part of the MCQs as well as application part of the MCQs, and you will do well in the laboratory session. This is the way to prepare for the pathology exam. So this is the resources we provide. If you effectively use in this method, you will definitely, inshallah, you will get the best mark. So I want all the students, at least the maximum number of students who put their hard work consistently, and with the help of Allah subhanahu wa ta'ala, I hope and I pray to Allah subhanahu wa ta'ala that you all will get the good mark. Yani getting good mark is not important. If you do this sincerely, inshallah, you will become a best doctor in future, inshallah. Okay, I hope we did our job as much effectively as much we can. So we expect good results from you people. Masalama.